Hello, it's Dr. Elizabeth Alter. Are you losing muscle during COVID? So, I've seen a lot of patients develop certain musculoskeletal problems during the pandemic. And at first, I thought, well, patients are stressed, more inflammation. But then what I realized is that patients weren't doing the weight training they were doing prior to the pandemic. And it's important, whatever exercise routine you had prior to COVID, that you try to maintain throughout this time. So basically, one of the main issues the patients are sharing with me is not going to the gym. So even if in your area the gym is open, uh, what's happened is that some patients are somewhat cautious about going to the gym. Obviously, when people in general are working out, they're going to be breathing harder. So, regardless of the mask, there is going to be more saliva particles in the air in general. But this is the time to get creative with doing exercises at home. So, whether it's with a few weights, an elastic band, some sort of exercise equipment that maybe you've been ignoring for a few years, it may be time to just take another look at these things because, more or less the shutdown started in mid to late March. And here we are 5 months out now. And hopefully, eventually, we will have some normalcy in terms of our outside of our home routines. But until then, I really encourage you to pick up your weights, pick up a jump rope, do something to keep yourself physically conditioned during this time, especially if you were doing weights, because that's the area where I've seen that a lot of my patients have been developing problems because they had stronger muscles and since COVID haven't been doing the weight training as usual. So so please make sure that you pick up some weights, and if you are hurting, make sure you're taking your Trauma NX, which is our turmeric product, which I lovingly call nature's anti-inflammatory or nature's ibuprofen. Well, I hope this helps and have a healthy day.